10 symptoms of pancreatic cancer that will shock you, critical warning signs, and today, this is perhaps the most critical question we have to handle. This is one of those questions that could, in fact, save someone's life. Pancreatic cancer. It's a silent killer with quite late detection, so the symptoms are everything. The pancreas is an organ in the abdomen, lying behind the lower part of the stomach. Pancreatic cancer is cancer that starts in the tissues of the pancreas. This kind of cancer is really serious because it's hard to find early on, which makes treating it harder. This is because the symptoms may not be immediate or may even be confused with everyday common issues. From the host of other reasons, one might be experiencing them. Not necessarily cancer-related. That's why knowing what signs to look out for is super important. In our video today, we're going to talk about the 10 warning signs of pancreatic cancer that you shouldn't ignore. These are like clues to you that something might not be quite right. Your body can let you know with these warning signs. What a difference it may make if people come in to see us earlier. What a difference getting the right treatment earlier may mean in terms of feeling not so great to feeling better or even living longer. Some of these may surprise you and others might be some things you have heard of, but did not know they could be associated with pancreatic cancer. The pancreas, an organ about the size of your hand lying behind the lower part of your stomach. Pancreatic cancer begins when abnormal cells in the pancreas grow out of control and form a tumor. Making hormones to control blood sugar and enzymes to help us digest food is the role of this really important organ. The pancreas is therefore treacherous in the sense that pancreatic cancer does not show very clear signs that something is wrong until the tumor has grown to a fair size or has spread to other places in the body. This is a big reason it is often found in later stages rather than earlier. The most salient drawback of pancreatic cancer would be the relatively nonspecific nature of the early symptoms of the disease. Sometimes early warning signs may be as easy and interpreted completely differently, like stomach pain, weight loss, without trying, or feeling very tired all the whole time. Such symptoms can easily be confused with trivial health problems, whereby people wouldn't rush for a doctor's consultation at once. Such procrastination gives time to the silent growth of the cancer. Being informed helps us make better decisions for our health, and encourages us to seek help when something feels off. Let's get started. Symptom number 1, jaundice. Jaundice is a state of health in which the skin and the whites of the eyes become yellow due to increased bilirubin in the blood. Bilirubin is a yellow pigment that the body produces when it breaks down old red blood cells. Normally, the liver processes bilirubin, mixing it with bile and then getting rid of it through your digestive system. However, under normal circumstances, the liver may be incapable of releasing bilirubin, or there may be a problem at any place that removes bilirubin. When a high amount of bilirubin gets into your body and accumulates, you may become jaundiced. This isn't a disease on its own, but rather a sign of an underlying health issue. There are several reasons why someone might get jaundice. This may be due to liver sicknesses such as hepatitis or cirrhosis, in which the effective breakdown or processing of the bilirubin in the liver may not be properly realized. It may also occur when there is an obstruction of the bile ducts, i.e. the passages of the bile from the liver to the intestine. This could be from gallstones or, in very severe cases, from cancers pressing upon or blocking these ducts, such as pancreatic cancer. Jaundice in adults often indicates a significant health issue that needs medical evaluation. In addition to yellowing the skin and eyes, it can be associated with other signs such as dark urine, pale-colored stools, and itching. These indicate to the doctor what is causing jaundice, for it is impossible to treat it without treating the problem that caused it. The awareness of jaundice and its meaning should hence be very key. This then would be the clear indication from the body of something that would have definitely gone wrong. More so with the liver or bile system. Symptom number 2, unexplained weight loss. Unexplained weight loss is a condition that occurs to a person without the intention and the cause of dieting or exercises. It's when you lose your weight without actually being aware or realize it yourself. Be it that your clothes are fitting looser or dropping numbers on the weighing scale when you have not changed your eating or exercise habits. While it might seem like a welcome surprise to some, it can actually be a sign of an underlying health issue. This weight loss could be of an all-of-a-sudden kind, not intending to, and whenever such is the case, then it might tell us a thing or two. That apparently, your body isn't getting the required energy from your diet. There might as well be burning of more calories than usual due to disease processes among many other possible reasons. This can be one of the symptoms indicating conditions of an overactive thyroid. Hyperthyroidism, diabetes, depression, or digestive diseases. Most importantly, this is also one of the common symptoms occurring in many types of cancers, including pancreatic cancer. Unexplained loss of weight may happen in the course of pancreatic cancer because of several reasons. The pancreas may be involved in such a way that its exocrine function for the production of enzymes, facilitating the digestion of food. Transcripts provided by Transcription Outsourcing, LLC. Unexplained loss of body weight is a warning sign that should always be taken with due seriousness. Symptoms should attract attention in case they are quite pronounced, for example, body weight loss of more than 5% in 6-12 months, accompanied by other signs of illness. Symptom number 3, abdominal pain. Abdominal pain is one of the common symptoms. It is pain affecting the area between the chest and the pelvis. The intensity of this pain may be from slight discomfort to severe distress. Causes of pain in the abdomen are varied, as this region of the body covers many important internal organs, such as the stomach, liver, pancreas, and intestines, and the origin of the pain can be hard to find at times. They may relate to the underlying pathology or be characterized by the location of pain. Sharp, dull, intermittent, constant. One significant concern with abdominal pain is its potential link to serious conditions, such as pancreatic cancer. In pancreatic cancer, pain progresses and is normally focal in the upper abdominal region, with referred pain going to the back from the side. This may be due to pressure from a tumor against organs or nerves around the pancreas. The discomfort can increase after eating or when lying down, and it will become more constant when the cancer spreads. Abdominal pain can also be symptomatic of less severe conditions, such as indigestion, gas, or a stomach virus. However, very severe pain that sets on all of a sudden comes along with jaundice, yellow skin, and eyes. Loss of weight not explained, or any changes in the habits of the bowels are all reasons to see a doctor immediately. These additional symptoms can indicate a more serious underlying issue that needs to be addressed. Don't ever ignore the pain in your belly, especially if it continues or if other accompanying symptoms occur. Symptom number 4, digestive issues. Usually, digestive troubles include the general kind of symptoms, which affect the gastrointestinal tract from the mouth to the anus. They usually take the form of nausea, vomiting, diarrhea, or constipation. Changes in the consistency or color of the stool occur mostly in a loose or liquid texture. Digestive problems can range from mild conditions leaving one feeling slightly uncomfortable to serious conditions that impede daily activities and even overall health. For instance, The cause may be a really common factor and result from dietary choices or stress or possibly from infections to more serious ones. Like the already mentioned chronic conditions, or digestive organs diseases such as ulcers, gastroesophageal reflux disease, or another essential on the pancreas, and pancreatic cancer involves digestion. The body's enzymes, which are secreted, help in the digestion process of fats, proteins, and carbohydrates for use in preparing the body for nutrient absorption. So, where cancer upsets this function, the absorption of nutrients is impaired and hence digestive symptoms. For example, in pancreatic cancer, nausea and vomiting are experienced because a tumor blocks the stomach and, therefore, food does not make its way through very easily. It may also lead to changes in the stool, such as steatorrhea. Fatty stool, which is the type of stool characterized when there is poor digestion and poor absorption of fats in the body. Problems to do with digestion in the cases of pancreatic cancer will also include abdominal pains and bloatings that are felt after taking food, since the body may have a big challenge in digesting food without a good number of pancreatic enzymes secreted. Excluding discomfort, all these symptoms can give rise to very strong nutritional deficiencies and weight loss. In general, these symptoms can have an effect on the quality of life and the health status of the patient. Symptom number 5, loss of appetite. The loss of appetite, or in other words, anorexia, is a medical condition that refers to the low desire of someone to eat. As much as this can sometimes be occasioned probably by stress or sickness, persistent loss of appetite can be a red flag for any underlying health issue. This disorder affects not only eating habits, but can also lead to serious weight loss and nutritional deficiencies, weakening the body's ability to recover from illnesses. There can be many causes for a loss of appetite. Psychological, such as caused by depression or anxiety. Physical, during conditions such as gastrointestinal disorders, chronic ailments, or infections. Most importantly, however, loss of appetite is associated with a number of cancers, including pancreatic cancer. In relation to pancreatic cancer, this symptom of loss of appetite may be noticed with several causes. The food substances produced by the cancer may lead to altering the taste of food or reduce the appetite for food. Additionally, it has a tumor that presses the stomach into feeling full even after one has eaten a very small amount of food. Some forms of treatments, such as chemotherapy, are also able to reduce appetite through its side effects that include nausea and other taste changes. The loss of appetite in pancreatic cancer is alarming because it leads to cachexia, a syndrome whereby a person experiences intensive weight loss or muscle wasting despite intake of calories being enough. It is not a trivial question of weight loss. That is the whole bunch of complications that can influence critically the strengths, immune response, and quality of life of a patient. Symptom number 6. New-onset diabetes. New-onset diabetes is the development of diabetes suddenly in an individual with previously normal blood sugar levels. It is most remarkable when the same occurs in adults over 50 years without manifest reason, such as major changes in weight, diet, or lifestyle. This could bring on symptoms of increased thirst and urination, unexplained weight loss, fatigue, or blurred vision. These symptoms arise because the body is unable to properly use and regulate glucose, sugar, in the bloodstream. In the context of pancreatic cancer, new-onset diabetes can be a significant warning sign. It is very important for the control of sugar in the body because through its secretion of insulin, a hormone used for absorbing glucose, from the blood into the body cells, sugar is balanced appropriately. If such a tumor involves the pancreas,